The silver bullet argument that is made to support unlimited immigration is that without it, the NHS would collapse through lack of medical staff. How wonderful, it is said, by those mainly on the left, a diverse NHS forced on the UK by the need of doctors and nurses, proving all the bigots wrong. In January 2015, The Guardian quoted Dr. David Rosser, Medical Director of University Hospitals Birmingham, one of England's biggest trusts, as saying, "The NHS doesn't have the number of doctors it needs. The shortage is real. We aren't training enough doctors in this country, and so we are dependent on foreign trained doctors." And just this week, Civitas has published a report saying that the NHS has deliberately trained too few nurses, leading to a reliance on what it says are expensive foreign and agency nurses. So we need doctors and nurses in the UK. Where better to get them than the rest of the world, so making the NHS truly diverse and proving once and for all that immigration is good, so more must be better. But put the words "global shortage of doctors" into your favourite search engine and it quickly becomes apparent that there are too few health professionals on the planet. Even the USA is short of a few thousand doctors according to a Forbes report earlier this year. So the UK, not training enough of its own, gets out its big fat imperialist wallet and buys the world's medics into the NHS. But while we are travelling the world with a taxpayer-backed health fund to tempt foreign doctors into the NHS, what is happening to the patients they leave behind? What is happening to the sick children and the infirm in those countries? Is there a bottomless pit of qualified doctors and nurses out there? No, the truth is that by not training our own staff and demanding more in the NHS, we have ended up draining health workers from the rest of the world, and I would wager it would be the poorer people out there that suffer the most. Money talks. So all those people that cheer every time a foreign doctor goes on the NHS books is actually supporting a sort of imperialistic situation where the states with the most power and money take all the benefits. We used to park a gunboat or standing army at the door. Now we just get the checkbook out. Is that really what the cheerleaders of the left intend? At least those on the right can say this is a market economy and we've got the money, so it must be the right and correct thing to do. The left should be demanding we take no more doctors and nurses from abroad, or that if we do, we pay the affected states handsomely for the privilege. Maybe we should be looking at it in the way we look at natural resources and only take them if they are sustainable in their country of origin. And before anyone says that it is the individual doctor's choice, I would ask if that makes it morally right of us to make the offer in the first place. Also, while we take all the doctors we can get to give us extremely expensive, cutting-edge medical help to cure us of obesity-related illnesses, the poorest in the world are dying from diseases born of poverty and malnutrition that could take a few pence and a doctor to cure. We need to do the right thing in the UK and train our own doctors, not selfishly drain the other countries of the world of theirs in the name of creating a perfect and diverse NHS for the UK. Thank you.